Yes, having completed renal physiology, let's discuss a few repeat questions that was previously asked in your NEET MDS exams. Decrease in urine output is called as. This is basically a medicine question. So let's discuss all these terminologies and we'll get back to the question. Polyuria. What do you mean by poly? Poly means increased. So polyuria means increased urinary output. Oligouria. See, wherever you see the term oligo means decreased. So urine output is decreased. Anuria. An means it's not happening, which means and. So no urine output is anuria. Glycosuria. Glycose means glucose in urine. Pyuria. Pi, anywhere pi refers to pus. So it is pus present in urine. Hematuria. Hemat means anything related to blood. So blood in urine. Proteinuria. Proteins in urine. Ketonuria. Ketone bodies in urine. Dysuria. Painful urination. If you have pain during urination, it's called dysuria. So back to the question. Decrease in urine output is called as, yes, oliguria is the right answer. Brush border is seen in, just think, can you recall the proximal convoluted tubule and its structure? Yes, they had the brush border segments. The answer is PCT. GFR is increased when? So this question is about, yes, Starling's forces. Just recall the 4 Starling's forces. Can you get the answer? You can even get the answer by excluding the other options. Yes, the answer is very good. D, increased renal blood flow. So what will happen if there is increased renal blood flow? When there is more blood flowing into the glomerulus, so this blood will increase the hydrostatic pressure here, which is called PGC. So how can you think of hydrostatic pressures? Pushing forces. So they will push the filtration to the other side, thereby favoring your filtration. So increase in renal blood flow will increase hydrostatic pressure on the glomerular side, thereby increasing the GFR. Look at the other options. Plasma oncotic pressure is increased. See, when your plasma oncotic pressure is increased, your pi GC will increase. When pi GC increases, oncotic pressure is a pulling force. So it is going to pull the filtration in the opposite direction. So this is not the answer. Glomerular hydrostatic pressures decrease, which is nothing but PGC. When PGC increases, it will increase the filtration. When PGC decreases, it will decrease the filtration. So this is not the answer. Tubular hydrostatic pressure, PT, on the tubule. Again, hydrostatic pressure is a pushing force. So PT will push the filtration in the opposite direction. So it is going to decrease the filtration. So thereby D is the right answer. In renal glycosuria, the renal threshold for glucose. Can you remember the splay curve that we had discussed? The threshold values of predicted threshold of 300 and the actual threshold of 180 and all. So in renal glycosuria, the renal threshold for glucose, what happens? See, when your renal threshold is becoming very low, it means that the effectiveness is becoming less and less. So when renal threshold is decreased, glucose will come out in urine. So when renal threshold is low, you will have glucose in urine. That's called as renal glycosuria. True about nephron. Sodium is actively absorbed in the descending limb of loop of Henle. In descending limb, is there any salt reabsorption? Yes, recall. What is the only event taking place in the descending limb? Yes, it is completely impermeable to salts. Only water reabsorption. 15% of water reabsorption is taking place. So this is wrong. 60 to 70% of GFR is absorbed in the PCT. Yes, I told you 60 to 70% of sodium, potassium, chloride and water are reabsorbed in the PCT. So this is right. Absorption of water occurs in the ascending limb of loop of Henle. Ascending limb, is it permeable to water? No, it is not permeable to water. It is permeable only to salts. So this is wrong. Filtrate reaching the DCT is hypertonic. So the fluid which comes out of the thick ascending limb, how is it? Is it hypertonic? In thick ascending limb, what is happening? Salts are reabsorbed, water is left over in the lumen. So it is hypotonic, not hypertonic. So thereby answer is B. Which of the following is not responsible to concentration of urine in the kidney? So we have discussed about aldosterone. We have discussed about vasopressin or ADH. We also saw what angiotensin 2 is doing to your mesangial cell and all that. Epinephrine. Epinephrine, we didn't discuss about epinephrine anywhere. So the answer is epinephrine. It has nothing to do with concentration of urine. Which part of the nephron is called as diluting segment? See, Ames question. Salts are reabsorbed, water is not reabsorbed. Which part is that? Yes, it is your thick ascending limb. The right answer is thick ascending limb. Over to the next question. Two substances probably can be used to measure filtration fraction. So what is the formula for filtration fraction? Can you remember? GFR by renal plasma flow. So out of how much which is flowing as plasma into the glomerulus, how much is filtered? That is called filtration fraction. And for measuring GFR, which substance did we use? Inulin. Inulin clearance. And for measuring renal plasma flow, can you recall which substance did we use? Yes, we used para-aminohippuric acid, PAH. So the answer is D. Inulin and PAH can be used to calculate filtration fraction. In which segment of nephron does the tubular fluid have highest osmolarity? So can you think of the answer for this? Yes, the answer is loop of Henle, because the fluid which leaves the descending limb is hyperosmolar. So the fluid which is entering into the loop of Henle, the thick ascending limb, it is hyperosmolar. So that's why the answer is loop of Henle. So now let's discuss few next pattern of questions which are anticipated in your next pattern of exams. Calculate net filtration pressure with the following data. Assume that no proteins were filtered. So why is this given here? No proteins were filtered. It's given because they are telling you that pi t value is equal to 0. What do you mean by pi t is equal to 0? Proteins are not filtered, so there are no proteins in the tubule. So that's why pi t value becomes 0. And other values given are glomerular oncotic pressure, pi gc, glomerular hydrostatic pressure, pgc, tubular hydrostatic pressure, pt. Now can you do this calculation? Yes, it was already asked in your Ames exam. So using this formula, net filtration pressure, favoring force minus opposing force. So when you do this, you will get the answer of 14 millimeters of mercury. Fluid in the portion of the tubule highlighted below. So what is that portion which is highlighted below? So the fluid which leaves the PCT. What is the tonicity of the fluid leaving the PCT? Yes, in PCT, salts, water, proportionately reabsorbed. So will the concentration in the PCT change? No, it will not change. That is why the fluid which leaves the PCT is isotonic. In a normally functioning kidney, which part of the tubule has lowest permeability to water during antidiuresis? See, this antidiuresis and all that is just to confuse you. The question is, which part has least permeability to water? Which part is it? Yes, the thick ascending limb. It is permeable only to salts. It is not permeable to water. So the answer is C, thick ascending limb. Which phase of the given cystometrogram is due to Laplace law? So what is Laplace law? Pressure is equal to 2T by R. So because of Laplace law, from 100 ml to around 400 ml, it remains a plateau. There is increase in volume, but pressure remains constant. So that is phase 1B. A 63-year-old Japanese man was admitted to a hospital because of thirst and polyuria. Patient had no smoking habit and would only drink little alcohol several times a month, but never heavily. He was diagnosed with central diabetes insipidus. What is his blood examination? Okay, what is central diabetes insipidus? Diabetes insipidus means whether it is central or nephrogenic, problem is with ADH. There is no ADH. This is the problem in diabetes insipidus. What is the role of ADH? To reabsorb water. How much of water? 10 to 13% of water. When you don't have ADH, so this does not take place. So what happens to all this water when it is not reabsorbed? It comes out in urine. So urine will become more and more watery, or I can say concentration of the urine will decrease. So low concentration. If more and more water is going out in urine, what will happen to your blood concentration? It will slowly rise. So blood concentration becomes high. So what is the answer? High blood or serum concentration, low urine concentration. So both B and C are answers. Yes, you got how we landed in the answer. So look at what is happening to the blood. Look at what is happening to the urine. Blood is becoming more concentrated. Urine is becoming more dilute. The answer is high serum or blood osmolarity and low urine osmolarity. Both B and C. So we have completed renal physiology with this. Thank you.